We're talking today about a problem that affects millions of people. It's a huge problem. It's called GERD, gastroesophageal reflux disease, which is tied to something called hiatal hernia. I'm going to clear these words up for you. So gastroesophageal reflux. Gastro means stomach. Esophageal means the esophagus or food tube. It's a problem between the stomach and the food tube. Reflux is when things go backwards. And in this case, stomach acid, which is supposed to stay down in the stomach, is passing the valve that should have stopped it and gone back into the food tube where it'll burn you because the food tube is not protected like the miraculous lining of the stomach protects against being burnt by acid that eats meat. It's meat that can resist acid that eats meat, but the lining of your food tube or esophagus can't do that. So if acid gets into the food tube, it's going to burn. It's going to cause an acid stomach, an acid chest. And the kind of pain that often is associated with this may start here, be in here, and sometimes go up into the food tube itself. We're going to talk about the cause of it. Treating the symptoms is what doctors all do. In fact, the most common prescribed drugs in America are for GERD, are for acid stomach, are for suppressing acid, and that includes Prilosec and all the drugs that keep you from producing acid, as well as the antacid drugs, substances that you can buy over the counter too, like Tums and Alka-Seltzer and other antacids that dissolve the acid and weaken it so that it doesn't burn you as badly or lessens the amount of acidity. Acid blocking drugs are super common, but they cause a real problem. Here's a very real hiatal hernia kind of story. I got a patient who comes in and tells me his girlfriend was tested and she has almost no iron at all in her blood. It's so dangerously low. And I asked him, is she taking acid blocking drugs every day? And he looked like a deer in the headlights. He goes, well, yes, she takes that every day. The problem, one of the problems with acid blocking drugs is you need to have stomach acid. To do what? Digest your food. To do what else? Bring in all the hard minerals that the body absolutely needs, the calcium, the iron. Those hard minerals are only brought in an acid stomach environment, so if you reduce the acid completely or shut it down with a drug every day, you will get problems because you can't digest those substances when your acid is being blocked and you don't have any. You need stomach acid. The problem is pain, burning, sometimes even ulcers. Ulcers where the stomach lining is actually etched or cut through, where the acid could have even cut through the stomach lining. You could even be bleeding. You've got raw stomach tissue now exposed to the stomach environment. That shouldn't be the case. The lining should be protecting it. And I'm going to tell you how you can even cure ulcers when you know what you're doing. What causes this problem? This is something they don't ask in medicine usually, of so many different things, and they don't in this case either. Sometimes they'll find the hiatal hernia, but they don't know how to treat it. They know that they could try to do a surgery and pull the stomach down, which is what happens in a hiatal hernia, but it works so badly they don't even do that surgery hardly at all. So what is the hiatal hernia part of the story? That is another part of the underlying cause, sort of the middle section of the story, of what is going on with the stomach that causes the GERD. And it is this. The food tube has to travel down, and then there is a big, strong muscle of breathing and respiration called your diaphragm, and beneath it is your stomach. Well, the stomach has to connect to the food tube, and the food tube passes through a hole in the diaphragm designed just for it and to hold snugly around the food tube. What happens is when you have a nerve problem, this is a chiropractic issue, in between the shoulder blades at thoracic number 5, I can't quite reach it, I probably got my thumb on thoracic 6 there, about 1 inch above where you might expect a bra strap to cross a woman's back, there you will find thoracic number 5 vertebra and the nerves that go to the hiatal hernia and the diaphragm. When that nerve is pinched in between the shoulder blades, you get a weakness to the diaphragm muscle, and now you can just move a little bit and tug the top part of the stomach and draw it up through the opening in the diaphragm, and now the top part of your stomach is sitting in your chest cavity where it doesn't belong, Wrong neighborhood for your stomach. It's supposed to be down in the abdominal cavity. The stomach resides below the diaphragm. When that top part gets trapped in the hole, then you get hiatal hernia, then you get GERD, then you get a malfunctioning valve that cannot control the stomach acid, not refluxing back, and you get all these problems. I've had so many cases of hiatal hernia I've fixed. Even in my very first months of practice, I had a guy fly down to me from Alaska. He wrote me thank you notes every Christmas for years and years and years for being in stomach pain for years, hearing I knew how to fix hiatal hernias, and boom, in just a very, very short time, we had him completely repaired. I'm reminded of another case that came in from London, England. He had not been able to sleep lying down for 22 years. He had slept sitting up. Why? When GERD becomes bad, when hiatal hernia is bad, the acid reflux occurs when you lie down, and people can't even lie down, especially after they ate. But when it's really bad, they can't lie down at any point. And in a matter of a few weeks, I had him completely fixed. Huge success story. Completely blissed out that his stomach pain was gone. He was able to sleep lying down. Everything was fixed. And to do this, you have to fix the cause of the problem, not just try to spray paint with drugs over the symptoms of the problem. So it starts with your nerve system, a pinched nerve in the mid-back, weakening the diaphragm. Now the diaphragm goes weak. Now the pinching hole around the food tube has gotten too lax. Now the top part of the stomach has glided up into the chest cavity, and boom, you have a hiatal hernia. Hiatal for the opening in the diaphragm, hiatus, hernia, the word that means something in the human body that moves through a hole it shouldn't have gone through. In this case, in hiatal hernia, the stomach has moved through the hiatus of the diaphragm and become a hernia and moved into the chest cavity, and that is the cause of the whole deal. How do you end up with the mid-back in trouble? Because that happens to so many people. Well, one of the reasons it gets into trouble a lot is that just in that same little few inch area that we find the nerve to the hiatal hernia, T5, we got the nerves to the pancreas, the adrenals, the liver, all of blood sugar regulation. And here we get into the problem that people have with sugar and carbohydrates. It is a huge, huge epidemic all over the world, America as well, that people overeat carbs, refined sugars, carbohydrates, rice, grains, breads, pizza, pasta, grains, cereals, sugar, sodas, all the various ways you can overeat carbs. And when that happens, all hell breaks loose in terms of health. And this is even as big a problem as this is, not even the biggest part of that iceberg. And it is big enough that it's got more drugs prescribed for it than anything else. When you overeat carbs, it reflexes to the mid-back, and many times that'll cause that nerve to pinch between the shoulder blades and start this whole problem up. It can also occur mechanically from the way people sit all day, or as a structural compensation. Lots of people have injuries and problems in their neck and lower neck. Almost everybody at one time or another ends up with some problem, great or small, in their low back. And the mid-back becomes a compensating twisting area that tries to make up for problems that have occurred in the neck or low back or both. How do we actually fix this problem? You have to have a multi-phase approach to get this fixed. You've got to unpinch the nerve between the shoulder blades. That takes precision chiropractic. You got to know where it's out of place, how it's out of place, and how to put it back into place. And that's done with our hands. When you're a well-trained, well-experienced chiropractor, you could be able to do that. Then you've got to be able to adjust the stomach itself. We've got to actually move it back down into the abdominal cavity and pull that part that's trapped up in the chest back down again. That's a specialized kind of organ adjustment that is only done in very few chiropractic techniques, mainly in the one called applied kinesiology that uses muscle testing. Muscle testing lets us know that you have a hiatal hernia, and I can test one and know it in less than 5 seconds. I mean, I can know instantly whether a person has a hiatal hernia or not. You want to ask your medical doctor if you have one? He can put you under full anesthesia, run a camera down your throat while you're knocked out, and take a look with a camera, and by the way, probably punch a hole in at least something like $1,000, I would guess, to get that done while you go through the risk of being under full anesthesia. And even then they miss some of the hiatal hernias. And what's he going to do to fix it if he finds it? Well, they used to do some surgeries. They don't hardly ever do them anymore because they don't work. There's actually no surgery that fixes this. When you think about it, it's a nerve problem and a muscle weakness problem. And if you're not fixing the nerve problem and the muscle weakness, what could you do surgically that's going to really fix this thing? It doesn't work. So we have to adjust the spine, we've got to adjust the stomach, and we've got to know the other reflex points that help us heal this whole thing. We know those in applied kinesiology when we're good at it. And there is a nutritional component to this where we can actually heal the stomach lining where it may be ulcerated or damaged. You can do that with certain supplements, and there are even certain juices that work beautifully for this, celery juice being one of them, cabbage juice being, you take a fresh, organic green cabbage and put that through the juicer, and a juice glass of that is miraculous for healing stomach ulcers. Usually in 7 to 10 days of taking cabbage juice, you can get rid of a stomach ulcer, but if you see your medical doctor, you can just take drugs for the rest of your life. This is one of the most important examples where finding the cause and knowing it, finding what's really going on and fixing the cause goes so far ahead of just taking drugs, treating symptoms, antacids, acid blockers till death do us part, and still being miserable because he never really fixed the problem anyhow with the drugs. But in this case, fixed, better, really done the way it should be.